Andy. This is Gregor Czuzak. Andy, you're welcome to start the second pop-up ecosystem webinar by ECH Alliance.
Thank you, Gregor. I assume you can hear me?
Yes.
Thanks. Thank you all, and thanks for all the people who are presenting today, and welcome to the second in our series of our new pop-up ecosystems. My name's Andy Bleeden. I'm the Director for Ecosystems and Membership here at European Connected Health Alliance. Just a little bit of background for people who haven't attended the first one of these. A, where were you? I'm joking. But also to give you a bit of background to why we're doing these. As many of you know, you've been involved with ecosystems for some time. Our ecosystems are there to bring together all the stakeholders involved with digital health, to bring all of the players together. And never has there been a more relevant time and opportunity for this than with the current crisis around COVID-19. Ecosystems, as you're maybe all aware, if you've heard me talk about this before, are there, and have always been around for as long as I've been involved with them, to break down silos in health and social care, as well as actually transform healthcare delivery, and also create opportunities for economic growth. For now, though, this must be online only, because obviously it's unsafe for us to meet collectively. And we'd like to bring together more of our ecosystems together in a multi-ecosystem framework. So these will not be based at the moment on a geographical or regional basis. They'll still be free, they'll still be permanent, and we're aiming to do these hopefully in different formats pretty much every week over the current crisis, obviously with breaks in between for people's holidays, etc. We will be initially targeting COVID-19, but again, those principles we always have with our ecosystems about leading with a need and having patients as citizens at the center is never, ever more relevant than it is today. You'll see we have a large and growing network of digital health ecosystems, and we want all of those to play a role. Some of these are new, some are still to emerge in the next 12 months. What we're trying to do, though, with our pop-up ecosystems is create a new offering for our ecosystems that we want to feature targeting COVID-19, our ecosystems needs and best practice. We want to offer a space for our ecosystems to go virtual, as well as create a regular program with rotating input from all our ecosystems, because never has there been a more pressing need for our ecosystems to collaborate together. We will make sure all of these ecosystems are both recorded and shareable. We would like to encourage these ecosystems to be a methodology where we can still engage, connect, and collaborate. And we'll also be approaching all of our coordinators to offer both the opportunities to get involved for our existing ecosystems, but also the ecosystems that are coming along and just about to launch. We very much see at the European Connected Health Alliance the idea of pop-up ecosystems as an agile way to work to increase access to best practice, but more importantly, to hear more of people's demand, because our ecosystems, we know, are struggling with the frontline service provision, tackling the rise in COVID-19. We want to be able to use our pop-up ecosystems as a method for our ecosystems to collaborate again, and also to be able to scale up innovation and adaptation, and bring in best practice from outside your country into your ecosystem where applicable. We see pop-up ecosystems as being agile, lean, and rapid, hence the reason we're running these in succession. What we've also tried to do with our members, we are a member organization, and never more so is that clearer for us to make apparent. We are sending out to all our members weekly member-to-member collaboration emails, issuing out opportunities around the demand side and the supply side, as well as webinars and funding opportunities. Because again, there is never a more pressing need to share this information across our membership. We want to be able to highlight need with solutions, as well as sharing both best practice and, as you'll see, new and emerging funding opportunities that are coming out from both the European, national and regional levels. Please share these with your network. This is information we want to share wider across the digital health ecosystem spectrum and across our network. But also come back to me with any specific needs you know from your local region, and we can share that with our members also. Please just email me directly. I'm quite approachable, and we will be able to share that with our members. That for me is it. I want to get on to the next part of our ecosystem pop-up now and bring in our ecosystems, because that's what this is all about. So the first person I'd like to, and it's with great pleasure to introduce my colleague from Germany, Alexia, who I've worked with for some time now, to talk about the Rhineland-Bonn ecosystem. Alexia, the floor hopefully is yours.
So I just need to share my presentation with you. So I hope you all see my first slide. Thank you, Andy, and thank you everyone for having me at this pop-up ecosystem today. And I'm very pleased to be able to present some of the activities that have been going on here in our region. And I'll do a very quick presentation of who we are for those of you who don't know the Health Region Cologne-Bonn. And actually, I'll do that throughout the illustrations and examples of different responses that have been seen here in the region. So I'll move up. And so the map that you see now, that you should be able to see, is the map of the Health Region Cologne-Bonn. The Health Region Cologne-Bonn is a members association, just as the ECH Alliance, and again, same as you. We've been noticing how important networking and collaboration is these days. Once more, the map, as you see it, is the geographic region of the Health Region Cologne-Bonn, which is and maybe for the wider audience, the Health Region Cologne-Bonn is the coordinator of the ecosystem Rhineland. So, just for general comprehension, the ecosystem Rhineland is broader than just our network and our association, but of course it is drawn upon the resources that we have and the connections and the corporations that we were able to build over the past 10 years. And the journey started with a very strong bottom-up desire to network and collaborate between the public, the private sectors, but also the research, so academia, and all sorts of different initiatives and further networks that were all involved in striving to achieve better health for the citizens. So this is also how we are very much aligned with the ECH Alliance's aim, and we put the patient in the center of all our projects and all our efforts. But yes, again, it did start with a very strong desire from, as I said, both public and private bodies. And so these days we've seen, so these are, so part of those listed here are our founding members. Some are newer members that joined us over the years. The most recent actually on the southern part of, so the blue line that you see is the Rhine. And the two most southern parts that are the districts that are listed here, they're not even part of North Rhine-Westphalia anymore. Most of you who do know Cologne or Bonn know that it's part of the very densely populated North Rhine-Westphalia, and I'll come back to that in a minute. But it's the border to another land, Rhineland-Pfalz, which is on the southern part again, is also very important because these areas sometimes are very rural, but they do look up and for example, for their in order to achieve emergency care, to access treatment, sometimes it's much easier, of course, to go and see the University Hospital in Bonn, for example, than it would be to go see the University Hospital further down south. So this is our region, and as you can all imagine, and as you all have been in touch with a similar type of stakeholders in your regions, these districts and regional councils, of course, they have their health centres in there, and they have their own public health bodies. These are the ones that are also in charge of reporting the numbers of COVID cases to the Robert Koch Institute. I'll come back to that in a minute. So they have been, of course, working way before the numbers start rising, because they've been putting in place the pandemic preparedness plans, and they've been preparing for what is actually unfolding now. And through our projects, we are in touch with some of them more than with others, because some of our innovation health projects are based and are being developed and drafted, designed very closely with the partners in the region, and especially, for example, one of the district region, the Oberbergischer Kreis, which is having a major role in an innovation partner. It's a consortium leader of an innovation health project here in Germany, that is actually concentrating on having an IT platform, sharing data. So all of these things that we would now think would be crucial in order to combat the pandemic, but that are still actually in the phase of being currently developed and not fully operational yet. And again, that's what we noticed, that it's kind of taking us all a bit short-handed, that we don't have these digital systems in place, maybe as other parts of the world already have. Some other of our members are public health agencies. I would like to specify and to make very clear that a member of the association Health Region Cologne-Bonn is only the BAD, which is listed on the left-hand side. So they've been putting out a lot of information on their websites. But funnily enough, and due to the geographics and the history of the region, Bonn and Cologne have historically hosted a lot of national institutions. So we also have the prevention, the main agency for prevention, the BZGA, which is on the top right, and we have the BfArM, which is given indications for the type of, in this case, the screenshot that I had was the type of masks that would be considered medical technologies or not. So these are not officially members, but they would be part of our ecosystem Rhineland, since they're based here in the region. We have a great number of companies in the Rhineland region. If you look at the small icon on the top right, the medical technology in Cologne and Bonn, it's a booklet that's been produced for the past 3.5 years by the Chamber of Commerces here in the region, so the Chamber of Commerce in Cologne and in Bonn, and it was actually meant to serve as a business card of the region to the world, but lately and throughout now the crisis and the responses that have been happening, obviously there's very more different and a lot more agile type of business cards that the region has been sending out to the world. So early February, actually, Lanxess, which is a biochemical company here in Cologne and the region, they've been sending products to Wuhan to help them out. And now, so if you go on the left-hand bottom of the screen, you can see that a lot of corporations are actually happening, and let it be Shell, the petrol refinery, who is also based here nearby. They've been also starting to produce alcohol in order to provide the necessary hygiene products. But we also have 3D printers that are now being used by the company RAM. They're usually an orthopedic company, but they are now switching their production to produce masks, face masks. And Bayer, of course, also here part of the ecosystem Rhineland. That is the large pharmaceutical company. They've been donating products to the city of Cologne. We also have Janssen, which is part of the Johnson & Johnson facility, They've been very early in providing information, and as we all know, also putting more of their personal resources towards fighting the virus and researching for vaccination. We have networks and research projects. One that I actually the picture is not on here. For those of us that are looking into the German media, we've been seeing a lot of Professor Hendrik Streeck. He's the virologist of the University Hospital in Bonn, and he's been one of the most famous faces, or he is now one of the most famous faces. He's a personal also consultant to the Minister President of North Rhine-Westphalia, and he's gone on to researching the district of Heinsberg, where the pandemic started here in North Rhine-Westphalia. It started where it started spreading, and he's looking at the developments of the virus. So we've got a very dynamic research landscape here in the region. The Clinical Virology Network has been existing for 10 years, and now, of course, dedicated all its efforts towards tracing the virus. We've got famous for those of you again who look at the German media, Dr. Eckhard von Hirschhausen is a famous doctor and comedian. He's part of a project, Share to Care, which is actually a shared decision-making project that is carried out by one of our members, Take Part Media. But they've also, again, produced little films and in order to provide information of what has been required in terms of hygiene, what does it mean, how the virus is spread, etc. So this is a very short and quick overview, but I'm aware of the time, and I'd rather take questions, and I'd like to finish the formal presentation here and enter more into discussions, and I'm sure I'll have lots of questions also for my colleagues presenting whatever's been happening in their ecosystems. Thank you very much.
Thank you very much for that. Wonderful to hear from you again, and we're very grateful for you to share the information from Cologne-Bonn region. We're going to save questions, if possible, until the end, so people can all come together. It's timely, though, to mention just this as something for you to think about during this meeting, is how quickly some of the old ways have had to change in terms of decision making and procurement and rules and regulations. And we should see some more of that now, I'm sure. With no great delay, I'm going to move, and this is one of the wonders of our pop-up ecosystem, is I'm going to move from Germany all the way to Galicia to listen to
if I may add one thing.
Oh, sorry, carry on, Alexia. Oh, you've been muted. Hang on.
Sorry, yeah, there's a small delay. I was about to add that
We're waiting. Oh no, you're muted again, Alexia.
Okay, sorry, because it still appeared green on my end.
We're all ears.
All right, sorry. I meant to add that yes, you just dropped the word procurement there, and we've been so as an association having all those very diverse members, we were contacted by the Ministry of North Rhine-Westphalia asking to reach out to our members and to make sure that whoever had material either already produced or in production, that made sure to pool those resources, and similar things is happening. That the responses that we got is that they actually we have already initiatives organizing the pooling of resources of products, materials, and personnel. So yes, to answer your question, there has been a lot of quick and early bottom-up responses, and especially of coordinated responses. Thank you.
Yeah. Excellent. Thank you for that. We're going to fly now very swiftly, without having touching through check-in or horrible security, all the way to Galicia, and to listen to Gisela from the south of Galicia, our wonderful ecosystem in Spain, and she's going to talk about the distribution of PPEs within the ecosystem. Gisela, over to you.
Thank you. So I just wanted to focus on the objective of the webinar, for which we always communicated to our members that it's like really hands-on. So I actually reacted to the person I was going to talk about the subject of AI applied to the response to COVID into something that we are doing from the cluster, actually me directed, and very to the response, a fast response. And so I will swift over who we are. You can actually check the web page there that we have in the 3 languages, Spanish, Galician, and also English, despite maybe nobody wants to really find out what is happening right now in Galicia and English, but nevertheless, we always try to focus to the 3 languages. And what I wanted to highlight simply is that the clusters have been used in the fast response of the first need that our country is having and still has, which are the PPEs. And how this is the first response, and then the second is also all the type of problems with unemployment and all the crushing economy that will come soon after. So I show you the webpage part where we dedicated to COVID, in which we have different parts, which is basically gathering all the information, opportunities, and funding opportunities, also other type of opportunities of collaboration platforms, marketplaces, other queries where people can ask us about almost anything. If they can walk the dog, yes or no, how far from the house, I mean, all kinds of questions. And this is a direct line with the ministries of social affairs, healthcare, and industry. And we found that has helped also our ministries to, within the chaos, concentrate in really not sending thousands of newsletters and putting thousands of webinars and different people talking, but rather filter the information and kind of educate our people to go to this webpage to really consult and update everything. Everything is updated to the minute because they send it to us before they really promote it outside in the different pages and social platforms. And so I think the gathering of the real-time information is a number 1. So then, as I mentioned, the first need of our country was the protective measurements, which again, we are scarce. And at the beginning, our country was organizing by the central government, and that was a bit of a chaos. But 2 days after, we as the communities had the power to buy and divide the PPEs. So the cluster was an important node to shout out to the not only our ecosystem within cluster itself, but also all the patient associations, or the particular people, or the nursing homes, mental health residents, all these that are not really specifically into our members, we are nevertheless giving assistance to them, to the point that even all the fishermen of Galicia have called the cluster my phone number. In fact, I don't know how they got my personal phone number, and asking for 10,000 masks, because they are the front line. So they are the people that are really making sure that we have food stock ready. So all this has been filtered. And the second thing that the ministries have done is we have weekly meetings with all the ministries, the 3 ministries together, on Mondays and Fridays, actually, to present the needs and requirements of our people, not only PPEs, but also the companies' requirements for doubts about, benefits, unemployment, tax rebate, many other conditions. So I think importance is the channels have been created for all these needs of funding. Lines have been established in agreement with what the companies really express the needs. The PPE was very easy, quoted easy, to really create those channels, because we already have quite a good logistic control of our different medical materials. So that was relatively easy. And it has been also implemented for nursing homes, everything is covered by the government. Nobody has to pay for anything until the alarm situation is released. So that is a good thing for companies that are worried about, of course, money right now. The issue we have next is the testing. It's something that our government has not done in a good way. So we don't have enough testing. So we are getting information of adaptation of protocols to do our testing in our own labs by RT-PCR, of course. And because the fast ones have proven to not be sensitive enough. Now, another thing that the cluster is doing, in particular our cluster, but other clusters I know they are doing similar things, is we are focusing two things. One, there have been donations that have been offered to the Ministry of Health, who has kindly redirected those donations to the cluster, because the Ministry of Health, well, for some reason, they cannot accept money donations. Of course, they can accept material, which all the companies have shifted into preparing materials, the ones that could, PPEs especially, but other type of material needed, medical material. So the donations, the money, liquid donations are given to the cluster, and the cluster has derived to projects activated for post-COVID needs. So there's going to be a lot of needs to resolve problems of prolonged confinements to vulnerable sectors, so vulnerable users. We all say that in our ecosystems, the user are the center. Here is a clear proof of it. And also, for example, to really be prepared for the social care problematics, such as people that have loneliness that we have now. There are lonely people that were autonomous, and now due to this prolonged confinement, we are in 23 days now. It's going to be at least 2 months. They are going to be scared of going out. They don't know how to really reinsert themselves. There are 91 over. I mean, we have 130,000 people over 70 years old living alone by themselves. So there's a lot of problematics that are being detected now, detected by banks that are calling us to see how we can help people really give themselves, how to operate online. A 95-year-old normally used to go and pick up their pension physically, and now they don't. So all these problematics, we are bonding together people from the cluster, different companies that have different added value onto these projects, and we are elaborating different projects to really derive these donations in the best way possible. And another thing we're doing in parallel is secure EU projects that were ongoing, justifications, calls, making sure that the companies that have the help from us to really help them prepare, because after, of course, deadlines have been postponed, but they're going to be there, and people have to be prepared for them. So we have had the chance from our regional governments to get our funding for international events that we had to postpone at least. That money has been prolonged, and we are going to be able to use it till the first trimester of 2021, so that the money is secure and the companies are going to be able to do it. So basically, we are trying to give a first response with a really practical need, and we are able to have the channel with the regulators, so it's a very important thing, and with the users, so it's really the key point. And also, we are caring for the economy of our companies, because if our companies die, we go after. And we are trying to activate the economy, but not just using funding just for using and inventing, but really there are going to be needs, and we are trying to identify those needs and getting the right stakeholder partners together. So basically, that's what I really wanted to talk, because I really do it every day from 8 to 8, receiving calls and receiving, trying to resolve issues that would take an insane amount of time on the phone lines that are open for that, but we're trying to kind of help them filter the first questions, and of course we're doing amplifying the information in our section with frequently asked questions, and we're going to put like that everybody asks kind of the same thing, so they can get the answer from there. So yeah, that's I hope that gives input. I wanted to really make a very pragmatic input. Galicia is a very beautiful land, but right now we really have to solve other things. So we are focusing on that. And of course, I will be happy to receive you all in Ries, which we are still going to hold on to, which is our major event of visibility of innovation in healthcare and social care. That's what we do on our normal days. That is going to be in October. So hopefully everybody will be healthy and happy and will come to Galicia by then, October 21st, 22nd. So that's about what I wanted to share with you guys. And we put it in English also because we are having companies from Germany, for example, from Bonn, Tech, that is wanting to test their devices of ozone disinfection of ambulances in Galicia. So Galicia healthcare system has agreed on collaborating with a Bonn company that saw us through the cluster website. So open to always collaborate, nevertheless.
Excellent. I can, just as a quick advert there, I can vouch for the fact that our Galician ecosystem is very open for collaboration and joint working, and is a wonderful place. And I think it's really positive to see practical steps an ecosystem is taking within the cluster there to address many of the issues that are day by day growing within our ecosystems. Before I move on, I'm going to plant a question for later for you and Alexia. What one thing, count those, Gisela, one thing could we help you with our wider network? Is there one thing that we could share or distribute or include? So what one thing? I don't need an answer yet, and I'll be asking the same to my colleagues who are coming next. So you get a little bit less time to think about this. But what one thing can we as a network help with in terms of distributing and sharing, or maybe even providing? Whilst you think about that, I'm really pleased we're going to get on that really fast jet plane again, and we're flying out of Spain to Serbia, to our Belgrade ecosystem, who have kindly come up, not with one, but with two speakers today. And I'm proud to introduce both Vuk Devernier and Živojin Sekolic. That's about as hopefully as correct as I can be. Who are here today, obviously, to talk about two subjects. First up is Vuk. I'm going to hand over to you now to talk about Doctorium, please.
Great opportunity. Thank you. It's a great opportunity to be able to talk to you. I think to start off with Doctorium, when we built it and when we envisaged it a couple of years ago and moved into this direction, it was built pretty much around situations such as this one that we are facing today. We didn't know of anything like that at the time, of course, and it wasn't our idea to build it around this. But Doctorium has proven to really help both the patients and physicians in this situation that we are facing right now, with a lot of people confined to their homes, with very limited access to doctors, and which have to be, timed really properly, and on the other hand, with doctors with very limited access to their time above everything else. So Doctorium, to start off with, is a system built out of two components. One is an application that you have right in front of you. It looks sort of like this, and it's in Serbian right now, but we will be making it available in other languages as well by the end of April. It is literally a system of triage and a booking of an appointment with a physician that maybe you know or you don't know. You have an issue that you don't know how to resolve, and we've built it with these three simple steps that you go through. You answer a few questions, you pick the doctor that you want to visit concerning the specialty and where you want to go and on what date and what time, and basically you are able to to book an appointment and get checked up as quickly as possible with all of your medical data available to the physician that is critical potentially for care. Now, with all of the young people who are healthy, usually there is very limited amount of that critical data that is available simply because they are very well. But with those people that do have a chronic illness, critical data such as therapies that they are using, allergies and so on, can easily be lost in conventional documentation that we are still seeing around our region. You know, paper being handed around and carried around without any electronic follow-up and ease of access to that data. So this is exactly why we've built Doctorium from the patient side as an application that is free and will forever be free for the patients. And building on these 3 steps and 3 easy systems, we have immediately upon appearance of this COVID pandemic and epidemic, we have reacted and we have built a COVID part of our application, which is available on the landing screen. As soon as the people open the application, they have these landing pages where they can either look through the prevention steps that they can take, or if they are worried if they are COVID-19 infected or they are showing some symptoms, they can go through these symptoms and they will be guided towards the national centers that have been established with their telephone calls, telephone lines and call centers, and they can immediately get in touch with the relevant physicians and the people that are there to help them and guide them through this entire process, whether they will be confined to their homes for isolation or they will have to visit a clinic and take the following steps. Now, this entire step was actually built not only for the patients, but it was actually built for the physicians as well. This is the screen that the physicians, what we call the system, this is what a physician would normally see. So basically, this is the template of potential appointments that a physician might have and their patients and their times that they will be booked. And through this system, the previous thing that you saw, the application would automatically notify the given physicians or the clinic that the patient has visited in the past 14 days or is planning to visit, so that they can undertake adequate hygienic and epidemiological processes so as to protect themselves, the staff and everybody involved within the clinic. It is a preventative measure, but also could be used as a diagnostic measure. Why do I say that? Well, if you've had a patient who has in the past 14 days exhibited COVID-19 symptoms, it's very likely that you and your staff should get checked up and see whether you are currently in risk of developing coronavirus symptoms. Now, building on from this, we wanted to move very, very quickly, and what we've originally envisaged through Doctorium is not only making appointments, making electronic health records available to the patients, we've also envisaged a step further that will be another level on this service, and we wanted to do it in the other part of the year, which is Q3 and Q4, but we moved it forward, and that is the telemedicine part. So basically, the electronic health system that you see in front of you right now on the screen will be combined with the telemedical part, which will prevent a lot of these visits that are actually happening and that are quite likely completely unnecessary, and exposing the staff and the physicians to potential infections, and also the people in the waiting rooms, the civilians, to unnecessary infections. They will be able to prevent all of this through simple telemedicine communication. In a way, I will answer the question that has been asked: what is the biggest issue that we are seeing? The patients have uptaken Doctorium wonderfully. We have a wonderful response from the people, and they really see the benefit of it. The people that do not see and do not understand the benefit, and that is a sort of a traditional cause. As a physician, I can say, we doctors are very difficult to take new technologies and adapt to them. And this is the biggest help that any incubator and any channel of communication can help us with. That is, communicate with the clinics, talk to the ministries, help us guide physicians into uptaking these new systems, which will protect them, first of all, and of course their patients as an addendum, if I may say. So with that, I thank you very much. And here are our website and contact if you'd like to get in touch with us and we can further discuss. Thank you.
Thank you for that. Very, very informative. And there are your contact details. We'll share those within our social media channels. Moving swiftly on, thank you for that input, Vuk. I'd like to introduce again Živojin Sekulic, please. Can we have the slides, please, for Živojin? Need to move from Vuk to Živojin.
Hi, hello everybody. I guess you can hear me.
Yes, we can. Thank you.
Okay, just find a way to share my screen. I guess you can see. Okay, first of all, I don't have a presentation. I'm not from the health sector. And so let me introduce myself in short. I'm an entrepreneur, having 10 years of experience in the automotive industry and around 5 years in IT. Had a chance to work in startups in Serbia and Silicon Valley. And so the story about Serbia hacking Corona is starting like 3 weeks ago, when the situation in Serbia started becoming very serious about the COVID-19. I was thinking, okay, what we can do, because the solution is just to sit and, do nothing and be quarantine, or to try to find, solution to help someone actually that is in the front line and fighting with that disease. So actually in that moment, I had any kind of clue what is actually the virus COVID-19 and how we can help our medical staff in their daily operations. And then I started researching and find out that actually the lack of ventilators is serious, and then maybe we can do something about that. So in that moment, I don't know anything about ventilators, but then I continue searching. Then I find a solution 10 years ago that MIT actually developed some kind of do-it-yourself ventilator for situations like this one that we have. And then I got the abstract from that project and started learning about it. So after that, I created one post on social media where I called my colleagues, friends, and others from the IT industry to think about, we have, in that moment, there was 2 ways, or let's say moods in the IT industry in Serbia. One is, okay, we can learn some new courses online, then upgrade our knowledge or something like that, read books and etc. Then another one was like, can we do something actually with our experience and our knowledge to help others that are now in needs for that? And then I proposed, okay, let's try to do something, using the experience from the software development, from the electronics part development, and etc., to combine those knowledge and create maybe our first ventilator or some other products. And that's how we actually start to brainstorm, to change opinion and create discussion. And in that way, we start thinking about, okay, what we can develop next. And we started actually first with the ventilators and MIT model of ventilator, and after that we go through face shields, protective masks with specific filters, then other household devices that can be also 3D printed, because the base of all these devices is actually 3D printer. And after a few days we started with the development on a massive scale, using open source models from all around the globe. We were using one model firstly, then another one, then third one, and our actually makers developed or adapted all those models to some better solution. And we started with a printing of several hundreds of face shields per day. Then some good people and good companies start helping us with a plastic injection. And in that moment, we were able to scale the production on several thousand per day. And until today, I think when I say we, all those people that I know and that I don't know that are actually the part of the community that is helping medical employees all around Serbia, created and distributed around 20,000 face shields. So at the beginning, there were just few people, I mean, 15, 20 maximum. Now there is around several hundred people from all parts of the country developing something on their 3D printers or laser machines, or using the plastic injection method to help them that are actually in a need. I mean, medical employees. Once we found that actually the face shields are a good product, I mean, we decided to go further. But before that, yeah, I would say something about issues that we had. At the first, we were trying to approach doctors and to present them that actually we know something and we can develop something, but we don't know actually if they will use it or not. And they were very, not interested for, I will not say cooperation, but they were thinking, okay, what it is, maybe it is not clinically tested, maybe it is not good. I mean, are we sure that we should use that? And in that moment, the situation in Italy escalated, and I think also they heard about their colleagues using, Decathlon masks for protection or as a backup for ventilators, and our doctors also somehow decided to give us opportunity. Okay, for example, I was talking with one doctor from one of institution in northern part of Serbia, and he was not interested in that moment to try that ventilator that we were proposing from MIT. A few days later, I received the message from him, okay, we decided to give you a chance. I mean, the guys that are developing actually that. And so once you have that prototype, please bring us to the hospital and we will test it. And that's how the situation started moving and becoming better, maybe. And once we actually got more people to start helping us and to be interested to develop different products that can help medical staff in Serbia, we decided to continue with actually the first idea, and that is the online hackathon. And we created the Serbia Hacking Corona, first kind of that online hackathon. Actually, it's not hackathon, it's some kind of hybrid, because there is no limit in time, there is no competition. All teams and the participants are invited to just develop something that is actually proposed in a application and to help medical people in Serbia. So they will not fight for some kind of reward, or there will be no deadline, but the deadline is actually the emergency and the life of people that are actually in a danger in this moment. So that's maybe the best drive at this moment. And once we created that proposal about developing five additional products, like full face masks, like Decathlon model, maybe you heard for that are Italian doctors were using as a backup for ventilators and as some kind of protective masks for their faces. Then also ventilator like MIT model, then different models of disinfection and sterilization devices like the gate for disinfection, and some software solutions. So we created a call on Sunday evening, and till today we received around 100 applications from highly skilled individuals that will work as in a different teams on the development of those devices. So we will close the application tonight, and from tomorrow it will start. So hopefully in next few days, 5 to 7, we will have some solutions and we will be able to offer them actually to donate them to the hospitals and to our doctors so they can use it. And yeah,
Julian,
everything is.
One minute. 1 minute.
It's okay. So everything is on a voluntary base. All these devices that are produced or will be produced should be considered as a donation. So no one is charging for anything. All participants are actually donating their time and their resources. Yeah, that's all.
Well, all I can say is, wow, that's just fantastic to hear. Fantastic also for the following reason. Last week, we also featured the Global Hackathon from the idea from Estonia, which kicked off over the weekend. So these things are happening, and it's good to see a really progressive use of 3D printing. So thanks for that, Julian. It's very, very informative. What, if possible, if you could send us through some links, and we can publish these within our social media for people to find out more. That would be
Sure.
really, really. So without further ado, we're going to move out of Serbia now and over to Berlin, where I'm proud, or I'm pleased, in fact, I'm pleased and proud, I should say. Why you can be both, to announce that at final notice to replace a mixer, we've had Eleonora Frati, who's very, very kindly offered to stand in for a colleague from Germany to talk about matching. Is it a nursing platform now? It's been built in a record time, so we're going to see a real practical, very quick approach again, and you'll see this to be quite, a repeated function, I think, across countries where things have been built, scaled up, badged up, and put up pretty damn quickly, as we say in English. Over to you, please, Eleonora.
Thank you so much. I actually want to thank you for giving us this opportunity, which we definitely appreciate and value. Yeah, exactly. So back to Germany, back to Berlin, although the project I'm presenting today is actually a project that is operating nationwide in Germany, and we're aiming at scaling up. So I want to present, I'm actually Eleonora Frati, working for Tunstall or Mitpflegeleben, as you can see here from the logo. But today I'm presenting specifically one of the projects that actually was born in this time of Corona crisis, Pflegesterne. Can you see the presentation moving? I'll do it like that.
It's just, we're just going to go to slide 2 by the looks of it. Click that button.
Now it's okay?
Yes.
Perfect. Yeah, so the idea definitely started by thinking, so Tunstall is anyway in general like operating and developing digital solution for care facilities and the care sector. So obviously in this time more than ever, we were actually thinking like what could have been like a digital solution and possible support to the Corona crisis. And that's why we analyzed, first of all, the situation in care homes or care facilities where the overburdened staff and the nursing staff has like very huge trouble right now. So on one side, obviously, it's increasing the number of infected patients and like people needs to be in quarantine. But also this is also true for the nursing staff themselves that are also getting infected, and therefore they need to leave their duty and their position. The implementation for necessary measure are not fast enough. So what we identified is like an immediate danger. So the care of residents in care facilities and care homes can no longer be provided because we're gonna miss like nursing staff. And the indirect consequence is actually the increase in infected inhabitants in care facilities that obviously leads to further exposure in institutions and hospitals. A similar situation, even worse probably, we can find in hospitals. So obviously the virus is so quick that it was like basically no way to cover up all the necessity all the necessary measures to facilitate and like overcome this obstacle. So all the healthcare facilities, all the hospitals, they're extremely overburdened, and this is like getting worse and worse, not just because in Germany we're still like on the rise of infected patients and cases, but also because the nursing staff that was already working is getting obviously burdened off and also infected. So also hospitals are basically exceeding their capacity. However, what we also analyze is that there is a huge untapped potential. We actually managed to find out that there are about 350,000 nurses that right now are qualified, but they're working in other professions and sectors. And there are about 225,000 geriatric nurses that are also like went through the qualification to become a nurse, and right now they're working in other professions. So why we're calling that an untapped potential? Because in this time of like abnormality and crisis, it totally makes sense to actually drive back our attention to all the skilled and qualified nurses out there to ask for their help. And this is why the idea of actually approaching them and reaching out to them to drive them back into duty and into hospitals and care facilities with short-term maybe contracts, just like for sometimes just for this time of crisis, or maybe even for longer. And that's why a movement was actually created, a movement that is coming and developing directly from the nursing staff, because as you could see from the picture, there is like exactly from the current already working nursing staff that this need is required. We already are extremely thankful for the entire nursing staff and healthcare workforce that is already out there and basically is providing the most basic but also like important work right now. And we want to make sure that they're gonna also have like this recognition, not just like the one already working, but the one also that are gonna decide to join them. And in addition to that, with Pflegesterne, we also want to obviously support this reintroduction in the nursing profession. So what was the challenge for this, let's say, matching to be happening? First of all, we definitely registered that a lot of these qualified nurses, they were willing to actually provide their help and like coming back to the hospitals and care facilities. The problem was that there are a lot of platforms out there, a lot of information, and this is resulting as usually in a loss of valuable time and confusion from their side. And on the other side, the care facilities and hospitals actually need support now and urgently. So the longer it's gonna take for new nursing staff to be recruited, the more costs and more delays will arise. And obviously the entire quality service will also decrease. And this is why a common platform was for us the solution. A platform that actually would have exactly matched this untapped potential and their offer with the need of hospitals and care facilities. How we came to that idea. So first of all, as a background, the initiators were Betiso, Mi Pflegeleben, the organization I'm working for, and Contact. And talking about hackathon, so we were definitely inspired by the fact that I think end of March for an entire weekend there was a huge hackathon via Gegen Virus here in Germany, nationwide, and this brought a lot of people, a lot of like talents and brilliant minds to cooperate together to find solutions. Out of that experience and the enthusiasm of people, we came out with this project, Pflegesterne. The lucky part and what makes us very special is that coming directly with ISO and also mit Pflegeleben, but also content directly from the healthcare sector and the care sector, we have a large number of supporters and advocates. So all the logos that you see here are actually all the care providers operating in Germany. And obviously this was possible not just thanks to our supporters and their expertise, but also thanks to like a very fast-paced startup mentality, which brought basically in 5 days an idea becoming actually a nationwide movement. So the 26th of March, we kick off, the idea kick off basically, thanks to Cornelia Rope and Jan Schroeder. And on the 29th of March, basically, we were ready, starting with Mi Pflegesterne. We were having a team and we were building the product. Since then, we've been working basically non-stop to actually not just like launch the product, but also launching our social media campaign. And I'm gonna go through that in 1 second. As already mentioned, basically the solution is this matching process. So on one side, we identify that a lot of is quite clear. A lot of care facilities needs new nursing staff and new personnel. And on the other side, we have a huge pool actually of nurses or qualified nurses that they can offer their availability. How we're gonna reach out to that untapped potential is through campaigning. So it's gonna be like a very strong social media and advertising campaign to reach to these potential nurses. Once the match is gonna be done, that is gonna be obviously based on geographic location, skills, and the needs obviously also of the hospitals and care facilities. Then we're gonna facilitate basically the exchange of information and contact details between the two parties, and the two parties will then manage to sort out like a short-term contract, or employment, or maybe in a longer term. And this is like, once again, to summarize. So on one side, we have we wanna make it more efficient and faster, all this matching process. That's why we're also having a national hotline, because some questions can be just answered way quicker on telephone. And on the other side, an automatic matching that is like helping us to filter and to actually get the right information to make the matching process doable. On the other side, this is actually all the work of an extensive campaign through social media, job portals, and other institutions, and public relations. So because obviously for that matching and that process to work, we actually need to start having users and like willing qualified nurses applying and willing to help out. So therefore our timeline, as I said, it was everything happening in 5 days. Basically, what's our status quo? So as you could see, we launched the campaign for end users, so for the potential nurses, on the 3rd of April. And today's the 7th. Yeah, we already kick off with the registration platform, meaning that we're now slowly having the first people, the first nurses registering to offer their help. But what we need is definitely to expand our network, to scale up, and to strengthen now our campaign and our reach out. Later on, new features will be possible, so that like exactly a more specific and more precise match between the needs of the hospitals and care facilities can be actually combined with the skills and the expertise that nurses bring with them. Why is this idea innovative? Why we're doing that? So obviously, as I already mentioned, I mean, this is a particular and definitely abnormal time for everyone, and we definitely wanted to do something out of our experience and work in the care sector, but also because we want to be, so we're extremely fast. We're managing to combine a startup mentality, which is the one of Mitpflegeleben, with actually the entire social and care system of Germany that still needs actually to be worked on in terms of digitalization. So we're managing to combine those thanks to the fact that we also have like this large network of supporters and expertise in the care sector. And we also see that the speed of with which we can actually be activating this platform and making the platform useful is very key right now. So we are we do all of that also as also mit uns Leben from the social economy and for the social economy. So there is actually no profit involved. We just the algorithm that was generated is only based on demand and not on the price, and we value the public interest and we're operating always as in that sense for the social sector.
Eleonora, 1 minute,
yeah.
please.
Yeah. To finish up, since kind of I was already asked by Andy, I think, what do we need and why I'm presenting this to you today? So obviously this is like the reality in Germany, and we know that actually there was already a huge a gap in the health workforce in Germany even before the crisis. So we can just imagine how bad it's going to become with this health crisis. But we also want to definitely, we see actually the platform scalable also in other countries. And as was mentioned at the beginning, this is an ecosystem and a European ecosystem. And now more than ever, actually, we should be talking about system of networks and scalability all over Europe, because the crisis doesn't have any border, definitely. So the needs, or like the point we're standing right now, is obviously that, as you could see from this slide, we definitely are looking for fundings, any kind of fundings, any kind of financial resources available, from donation to European fundings that are available. But we also need, and maybe that's just easier and simpler, we need reach out. So we're reaching out and through social media to end user, and that's already a great help through Facebook, Instagram, and any other kind of like job portal and online social media campaign, but also yeah, through politicians and German ministers. And this is our team. Thank you so much for your attention.
Since we don't hear Andy, I shall take over. Gregor here. James, are you in the audience?
Yeah, can you hear me?
Yes, we can. Sorry
yes.
about that. Just before you start off, James, just quickly, thank you for that, Eleanor. Very interesting. I was trying to get across what we have spent decades doing, in my experience, of having project initiation documents and planning for the next 6 months. You've just seen there, hopefully this gets tipped upside down on its head from that fascinating example from Berlin. So thank you very much, Eleanor. So I was on mute. James, I'd like to hand over to you, please, and introduce James Champion from Tunstall. This is where we want to bring in, as we do in all of our ecosystems, it's important to hear need and potential solutions from our members. And we'd like to introduce today one of our European Connected Health Alliance members to talk about their response to COVID-19. James, the floor is yours.
Thanks, Andy. Good afternoon, everybody. From the UK, it's a bit like the Eurovision Song Contest, but far more exciting. Just like to present what we're doing over at Tunstall. We have spent the last 60 years keeping people at home, safe in their own environments and well, through two major platforms, our telecare solutions and our telehealth platforms. And what we've done in the coming slides is adapted those to meet the needs of COVID-19 for our customers and people that don't even know about us, the individuals at this stage. Could I have the next slide, please? Or can I control it? So the individual challenges, we know that there are at least 1.5 million people deemed to be at high risk over the next 12 weeks at least. And with the strict social measures that we've got in the UK right now, it's really a chance for Tunstall Solutions to play a very key role by adapting some of the technologies and solutions that we've been using on a global basis. So the first that I'm going to touch upon is the Wellbeing Call Service, and then we'll have a quick look at Tunstall Connect. Next slide, please. So our Wellbeing Call Service is run by our Tunstall Response Centre. We have our own alarm receiving centres that are used by our telecare customers. And this involves a proactive call service, as you can see there, for vulnerable people in isolation. It's surprising that when we did an analysis of our customer base, over 50% of the users who are on our response call centre are have no next of kin. So this is designed specifically for those people to make sure that they're kept well at home and they're not socially isolated. Our response operators, as you can see there, are able to advise and support and signpost to any further services that may be required. It is not an emergency service as you traditionally know, but they can press their emergency buttons on their triggers that they have at home, and they'll get straight through to our call center 24/7. So we are always on hand to support them. I'll talk a little bit later about the other ways in which we're doing this through our ICP Triage Manager, which deals more around the telehealth, but has been adapted again to look at social isolation and mental well-being. Next slide, please. So Tunstall Connect is something that we've been using for some time in our Australasia division. It is designed initially as a lone worker device solution, but we've adapted it to cover people who may not have access to a full, or require indeed a full telecare solution, but really just need to check in and make sure that they're okay with our response center. So individuals here will literally book a call or dial in at 8 o'clock in the morning. They would then receive a reminder to check in at 8 o'clock in the evening, just to let our call center staff know that they're okay and that nothing's changed. As you can see, it's readily available on Android and iOS devices and dials straight into our call center. It's a feature that can be turned on and off as well. So if individuals are feeling better and don't need that support from us, then they don't get woken up at sort of 2 o'clock in the morning or whatever other time they may choose to send their reminders. It also has an SOS button, again allowing the individual to contact response directly and call for support as required. It's worth pointing out at this stage, this is not designed as a replacement for a traditional telecare service. It does not meet the compliance standards. So what it does allow our customers to do right here, right now, is to, rather than having to stretch their tight budgets and their tight timeframes, it's a readily deployable solution that meets a very immediate requirement for their customer base. It also has that GPS functionality. So for us that are in the UK who are allowed out once a day to go either for a run or for a walk, you can be tracked and maintain that security, knowing that you are covered by Tunstall. Next slide, please. So importantly, our heroes in the NHS are required to free up a minimum of 30,000 general and acute beds. They have to discharge an estimated number of inpatients to free up 15,000 beds. That's just in England right now. And so what we have created, or not created, what we have brought to the market previously, and we've adapted to meet the COVID-19 need, is our ICP Triage Manager and My Mobile solutions, both of which are Class 1 medical devices, and they are the other half to the coin that we have of telecare. So with the telecare and the telehealth solutions, we're really covering people for all their COVID-19 needs, wherever they appear on that continuum of care. As you can see, it supports people with chronic diseases, and it does allow risk stratification by clinicians to identify who needs the most urgent attention. Next slide, please. So how does it work? The Triage Manager side of it is the clinician portal, in effect. That allows our customers to build and design questionnaires if they need, whether they be around social isolation or well-being. We have pre-created questionnaires for major chronic diseases such as heart failure, COPD, etc. And it allows those questionnaires to be distributed to a patient's bring your own device. So there's no need to invest in hardware or infrastructure at this point. It also facilitates the need, and the very urgent need that we all have, for clinical staff to employ the social distancing from patients, as our colleagues referred to in one of the presentations earlier on. From a patient perspective, it's very, very simple. So it's downloading the app, a code is requested and then supplied, and then you're logged into the system. There is also, if you could move to the next slide, please. There is also the facility for educational material to be pushed and streamed down to the patients. I've talked to you about the questionnaires that can be tailored, but critically what we're seeing from the emergency NHS Nightingale facilities across the country, this would allow patients to be discharged with a safe and sound knowledge that they are being covered at home and are not just being taken back into the community with no ongoing support. It will also mitigate some of the issues we're seeing around mental health and loneliness, as I've said previously, by allowing patients to check in, and it can be used in conjunction with some of our other services. And I would point out also that it's not just a COVID-19 response, it's future-proof as well. So that whole business about COPD and heart failure, where we're seeing the strains on the health system as it is, it allows them to continue that care onwards for a period of time that we don't yet know when we're coming out of the back of COVID-19 in the UK. Thank you. Next slide, please. So the other piece to our solutions is for our monitoring centres, our alarm receiving centres that cover the expanse of the UK and Ireland. We're seeing some of the challenges coming through, that they have staffing issues due to reduced workforce, and social isolation is an issue when you're working very tightly and closely in a call centre. And there's huge demand on those services for individuals right now. Talking to one of our customers, they've seen a 40% reduction in their workforce in 1 week alone as COVID-19 started to bite in the UK. And the other challenge that we've seen is our customers need to empower their staff to work remotely at home, as we all are at the moment. So we have 3 solutions that I will cover off in the next slides, please. So the first one covers the remote working. It is available for all our existing PNC customers, and we are working actively to identify what infrastructure requirements need to be carried out, any hardware that's required. We are reconfiguring what we call our PNC networks. That's our platform for the alarm receiving centres across the UK to allow them to work remotely. It allows you to not only to have people working out remotely, but it frees up the space within your existing facilities to engage, or to employ, I should say, that 2 metre social distancing advice from the UK government. Next slide, please. So these temporary managed services that we're offering are specifically tailored for our PNC customers who have a low number of operators. We all imagine call centres and alarm receiving centres to have a huge amount of people on standby supporting our customer base, our users. But the reality is that there are some smaller organisations out there who, if they get struck down with COVID-19, will not be able to continue offering the services to the end users and the vulnerable and socially isolated. So Tunstall has adapted again our solutions to provide a flexible service between 1 and 6 months to our customers. And what that allows them to do is to hand over their customers to be managed by Tunstall's own alarm receiving centre response. As part of that, we can offer proactive wellbeing calls in conjunction with the ICP Triage Manager and some of the other solutions I've gone through with you. And what it does facilitate is it allows customer resources to manage the challenges that they're facing due to the COVID-19 outbreak in case they need to redeploy their resources. Next slide, please. And the final solution that we've got for our monitoring centre is a third line disaster recovery service that we provide. Now, typically, our customers are required to have their own disaster recovery services, and indeed, we provide that for a number of customers in the first place. But a third line disaster recovery is able to support multiple call centres that may be struck down at any one time. It's very quick for us to transfer the data, to build the database, and to replicate services and manage the installed base, or the users, I should say, for our DR customers. And again, you know that you're coming into our response centre, who have a 24/7 service with experienced call handlers. That is typically available to our latest customer base who are on our latest platforms, PNC 7 and the latest version, PNC 8. And we're working with the installed base across the UK to identify any gaps in technology that we may need to support customers to fill, to enable them to benefit from this third line disaster recovery service. So I hope that, in summary, I've given you a flavour for how quickly Tunstall's been able to respond and adapt and overcome some of the issues our customers are facing, and we remain in support of both NHS organisations and local authorities to provide the care and support that they need to do to keep our communities safe and well at home at these very difficult times. Thank you.
Thank you for that, James. Very informative, and I think one of the things also to get across is you've got opposite numbers in all the countries we've or that cover all the countries we've seen today, which we can patch people to as well. But it's really useful to see how our members are adapting to COVID-19 and adapting their solutions. Both quickly and we successfully as well. So thank you for that, and thank you again for all of our speakers. Now, we asked, sorry, I say we, the royal we, I asked a question earlier on of all of our participants today. And I'd like to just, before I move to the rest of the participants who are online, I want to come back.
Yeah, I muted Andy because I tried to unmute everybody, but I think Andy can speak again. I apologize. My mistake. Andy? Yeah. Okay. I've done a grave mistake. I actually used my executive power of administering this platform to exclude my boss. So well done, and he's not coming back. I guess I'm not coming back tomorrow either. So I tried to unmute everybody. Can somebody enter the discussion right now? So just
I'm
so
still
that
here. I don't know if you can hear.
Sure. So that was awkward silence. Okay. Thank you very much,
Okay.
dear
So
Andy.
did you get my question? Shake your head,
No,
Alexia, or nod, please.
No.
Okay. The question
No.
was simple. Don't worry, Gregor. I forgive everybody. The question was simple. To all our speakers first, how can we help as a network to help with your needs as an ecosystem or as a member or as a participant today to help with you in the Rhineland area or in Galicia? I'd like one please from each of our speakers. One need. If you don't have any, please just say that's fine. We can come back to. But one need, not just in terms of I need, some masks or whatever. How can we, as an ecosystem network, help with your ecosystem? I'm going to go straight to the beginning and ask Alexia, please, first. If you have a question. We'll need to unmute Alexia. She's doing what I was doing.
Yeah, just a second. Unmuted.
Her question was, how do you unmute me, Gregor?
Excellent. Yes, that's great. Yes. Basically, my response is very straightforward. It's help the ecosystems drag together the lessons learned. I mean, this is a time of crisis, and some are very fast-track responses, some are very agile responses, but we're all striving, of course, to respond to the crisis in best terms, as we, in regular times, all strive to address demographic change and, a very large part of the population living at home with chronic diseases. So we all strive in actually addressing those issues, and at the moment within a very specific framework and very, very special and stressful conditions. So the best that we can do is learn from that experience and map all the responses provided by ecosystems, by their members, by best case, by the good pupils in our regions. What has been going well, what was tried but failed. So really have a proper lessons learned going on, and a repository maybe of responses. I guess that would be very useful, not just for now, but also for the years coming.
Thank you. Thank you for that, Alexia. I think that's something we can help with. And I think that's, in a nutshell, what we're trying to do with our pop-up ecosystems, especially on this topic. And we can share, and I think if we can keep this going, I should come back to where we're going next on this. Just briefly, But moving quickly on, like the people in the Eurovision Song Contest, we're over to Spain. If they're still there, Gisela.
No, Gisela needed to go to another meeting.
Nil point for Spain. Sorry, no, but she very kindly shared her contact information for us as well. So we'll broadcast that, and we've been putting some slides as we've been doing this on social media as well. Not all of them yet, but this is being recorded and we'll be able to share. Without further ado, I'm going to go straight to Vuk.
Unmute, yeah, the same story. So just a second. Unmuted everybody, you unmute yourself now. Vuk, does it work? No, I will repeat, just a second. Does it work now?
Yes.
Yeah, it works now.
Now it works. Yeah, well, basically during the presentation, I said the biggest issue, and this is more of utopistic requests that I could pose to anyone, is trying to educate the relevant authorities, networks, and anyone that has influence on physicians, from our perspective, to accept new technologies. As I said, me being a physician, I am speaking firsthand, knowing how difficult doctors are to take up new technologies and new solutions. And in such a time as this COVID-19 crisis that we have, it is most important to keep an open mind from a clinical perspective, but also maybe from a scientific perspective, and for those that work in a private sector from the business perspective. And it's very, very difficult to make a positive impact and influence on the physician's mind that something is going to help them, even though when it's very, very obvious that it will.
Can I give you a comment here?
Sure.
Well, it is utopistic, but on the other hand, if you know what their need is, then it works. I will give you an example. Our Norwegian colleagues told us on Friday in a discussion I had that they are preparing a webinar for the doctors that was super well accepted. Yesterday, there were more than 1,000 doctors in Norway. Norway is a small country. They participated in a webinar. Can you imagine that? I don't think there is a conference in Norway that 1,000 doctors appear in. And what was it about? It was, how do I use video to talk to my patients?
That is amazing, but that's
Norway. You need to do the same thing. You need to cater to the urgent needs. We repeated it. I also work in the Slovenian ecosystem, so my basic home territory. So ECH Alliance is basically a network of people working in different places, okay? Even on this very call, we were coming from very many different. So what I did afterwards was immediately talk to my co-lead of the ecosystem and said, we need to do the same as Norwegians are doing. I said it on Friday already. Yesterday, we approached the medical chamber, which is the most important body for the doctors, and say, would you like to do it? The second one we approached was the National Institute for Public Health, who hold together the infrastructure for healthcare, because you need to make things integrated. It's very dangerous to think that every isolated solutions are fine, but we need systemic solutions. And you know what their answer was? Absolutely, we need it immediately. And we're already working here locally with the Medical Chamber of Commerce and Medical Chamber of Slovenia, and also working with the National Institute of Public Health. It's true, it's much easier if you know people from before. I don't think I can get trust in some third party that I didn't know from before if I wanted to do it from scratch. Work with the people you know. Don't try to just create relationships out of nothing, okay? So that's my message.
Thank you. Thank you. We will pursue that avenue.
Fine.
Thank you for that, Moog. I think I'm going to go straight over to Civilian, please, if you have a request or a need. And I'll be unmuted. Or muted even.
It should work now. Okay.
It works.
So, well, I agree with both Alexia and Vuk. And maybe my conclusion should be sharing is caring, actually. And if we will be able to open our solutions and to exchange ideas together, maybe we can support each other better. Because, for example, the concept with that decathlon mask that was developed in Italy a few weeks ago is just one of examples. And I'm sure all around the globe something like this is happening. And of course, most of those products we can find and we can learn about it. But also some of them are still missing and some initiatives are still under the radar. So opening our solutions to all others and supporting with brainstorming and idea exchanging, we can support better maybe all of the participants in this fight with COVID-19. So if you will need maybe some kind of support from our ecosystem and maybe solutions that will be developed on the Serbia Hacking Corona hackathon that actually will be open source, we are more than interested to present that to others and also to support others in developing of the products like that, but also our need will be to receive the support from the other ecosystems that actually develop something like that and that actually has some kind of blueprints or open source that are able to share and we can just build and scale up fastly. That's all.
Okay, thank you very much for that. Just another small wee plug, as we'd say. We are, for all our ecosystems and our members, we have this member-to-member demand supply email that we send out weekly. We're now on our fourth one. I think we do these. We've done these weekly now. We're now on our fourth one. These requests are the ideal place to put this. They don't need to necessarily be a large-scale website. We've got a brand new product. It can be a simple request for support, but also from yourselves, you know, you can see there's requests for information. We've got portals there for suppliers to be able to provide to need. So please use that. It's your platform to use and engage with. I want to quickly move on because we're running out of time. I want to just patch into Cornelia, please.
Eleonora.
Eleonora, yeah, it's fine. So I think as said during the presentation, our needs right now, they're mainly funding. So whether it is like coming from public funding, national or European wide, and in that sense, then if it's a European funding, we're super open and looking for European partners to work with. And in second place, like reach out. So we're actually in this strong online campaign through social media and public relation. So especially not just like through the end user and Facebook, but also like we're really trying to reach out to ministries and like ecosystems, clusters that can actually reinforce our contacts and our supporters.
Excellent. Thank you for that. Again, with your one of the things I noticed with your presentation, there's talk about money. We regularly feature funding opportunities as part of that member-to-member thing. So pay attention if you can to that. There's plenty of funding opportunities coming your way. I'm going to move swiftly on because we've got a time limit for this broadcast. To James, anything we can do to help? He says, in a county voice. Sorry.
One of the biggest things that we find as a global organization is the matching international spirit that ECH Alliance presents. Just working on this call today with the various colleagues from the various countries has opened up the kinds of things that we are looking for, which is these fabulous innovative ideas that collectively, when you put them together, can deliver meaningful solutions for the immediate needs of COVID-19, but for the longer term as well. So please, more of exposure to innovation that helps us build out our ecosystem of partners that work with us on telecare and telehealth.
Andy? I promise I didn't do anything now. I really didn't.
What we're trying to do is to broadcast that. The question specifically, and I don't know if you can see that, is specifically from Australia, and this is through Susan Faitosa. We can put the contact details afterwards. Hopefully it's Susan. If not, sorry, Susan. This is what they're particularly interested to know if any ecosystems or companies have received inquiries or requests from Australia, because they're obviously in a different position from us. If so, what sort of inquiries and requests? So that's one specific question. I'm conscious of time. Okay, what we'd like to do, if possible, and we'll send out some information to some following questions, is close off today. I remind you about our member-to-member collaboration portal. Just on our pop-up ecosystems, we've had as many more people this week than we had last week. We're going to be running our next in the series of pop-up ecosystems. This time, our next ecosystem is going to be targeted at the moment towards our new and emerging Latin American ecosystems. That's going to be, we're hoping for a date on the 23rd of April. So next week we'll take a small break because we're aware that people may be away, or not necessarily away from their homes, but at least away from the work maybe. And then we're looking to then launch another one of these pop-up ecosystems for the following date. He says, putting his glasses on and reaching to the calendar, the 29th of April. Okay, so put that in your calendars for now. I think this is a good enough time of day, so we will repeat in that, unless you hear otherwise, at 1300 hours CET, if you want to use it properly, and 12 o'clock GMT BST as well. We would like to share and circulate some of these questions. I think a good way of doing that is via our social media. Obviously, if people object to that, we would not do so. But that's, I think, enough from us. Gregor, any input from you? Any last comments?
Apologies for still not knowing how to use GoToWebinar like last week. And being on video all the time, which I was told
yes.
in the middle of the
look, it's not big enough for all the other people looking into this. I'm going to close today's meeting. Thank you very much, Gregor, and all our colleagues within European Connected Health Alliance. Thank you also to our speakers. Wave now. Thank you.
Thank you. Thank you, everybody.
And wave again. We can all wave now. Thank you again for those people who've taken the time out to come along today, participate and share. This is the nature of pop-up ecosystems. I'm hoping by the next time we do this, we will be using a new platform. GoToWebinar is a little bit funky in terms of its usage. So we will hopefully be looking to address this during our next couple of weeks. And we'll be speaking to you very shortly. Thank you very much. Goodbye.
Thank you. Bye-bye.